Good afternoon, and welcome to the Adrian Jules Foundation's second Google Hangout, Tobacco, the LGBT community's biggest health burden. We are excited to begin Pride Month with this important conversation, and we are very grateful to have such outstanding panelists join us today, who I will introduce shortly, but first I'd like to provide a bit of the background as far as the impetus behind this Google Hangout. My name is Lindsay Poole, and I am a program coordinator at the Adrian Jules Foundation. And our foundation is focused on eliminating health disparities through public education. We currently have a tobacco education campaign, and it's designed to reach those communities that are most affected by the tobacco epidemic. And the idea is to motivate them to make healthier life choices and also to affect public policy. Our foundation was founded by Gwendolyn Young and was named in honor of her mother, who passed away 25 years ago tomorrow at age 59. And she did pass away from a tobacco-related illness. So tobacco education is something that, as a team, and as a foundation, is very close to our hearts. For years, the tobacco industry has deliberately targeted the LGBT community, and today there are reports that reveal that this community smokes at rates that are 68% higher than non-LGBT communities. And we also know that tobacco remains the #1 cause of preventable death and disease in the United States. And these are statistics that we cannot accept. And our hope today is that this conversation will spark a change. And we have 3 primary objectives. The first is to expand understanding of this disparity. The second is to increase our awareness of the tobacco industry's deliberate and aggressive targeting of the LGBT community. And the third is to explore LGBT representation in mainstream tobacco. We have with us 4 leaders in LGBT tobacco health and advocacy. And I will introduce each of them briefly because their bios deserve much more time than we can dedicate today. And I'm going to ask that each of the panelists do a quick wave when I do state your name. Linda Ellis is the director of the Health Initiative, which seeks to improve the health and well-being of the LGBT community in the state of Georgia. And she has a number of accomplishments, one of them being that she's really expanded the network of healthcare providers that do have that cultural sensitivity and can cater specifically to the LGBT community. She's also established the Health Fund, which seeks to support and provide healthcare to those who are uninsured. And Linda is also the co-chair of the Smoke-Free Coalition of Fulton County. Francisco Butchting is the Director of Grant Making and Community Initiatives at the Horizons Foundation. And he is a research scientist and public health professional. He has over 25 years of experience in health advocacy and community activism. And his recent work has focused on health disparities and health equity within both the LGBT and Latino communities. He's also co-chair of the American Cancer Society's California LGBT team and is the past steering committee chair of the Network for LGBT Health Equity. And Bob Gordon is the California LGBT Tobacco Education Partnership Director. He has participated in a variety of LGBT advocacy projects. And also, as a master's student at San Francisco State University, he wrote an incredible paper about the birth of the LGBT tobacco control movement, which he was a part of and which I had the pleasure of reading. We also have a 4th panelist, Dr. Scout. He's not logged on at the moment, though we are hoping that he'll be able to be with us soon. And he is the director of the Network for LGBT Health Equity, which is one of 6 CDC tobacco disparity networks that the CDC funds. And I should say that the network released a viral infographic that concluded that tobacco is the #1 health burden among the LGBT community, and that is where the title of our hangout came from. Dr. Scout has been doing LGBT health policy analysis for over a decade, and the CDC previously named him Health Equity Champion, and he also recently returned from Italy, where he was doing the Bellagio residency program put on by the Rockefeller Foundation, and he was focusing on writing about transgender health policy. So we have a great panel. Thank you so much for being here, and I'm now going to ask that each person please give a brief opening statement. Linda, we can begin with you.
Okay, I'll go ahead and start. We operate in a unique world, I believe, here in the Deep South. That's a little different from experiences in other major parts of the country, and I often find that we're not necessarily behind, but we are taking a different path given our culture and environment here in the South. And the same is true with tobacco work as well. It's very difficult to move and introduce tobacco work in our community. We've done studies that show that the prevalence of tobacco use among the LGBT community here in Georgia and in the South is higher than in some parts of the country. We lack some of the support that our counterparts around the country can get. So we have to be a little more creative about how we do things and relationships that we establish with mainstream folks working in this community. But we're excited to be a part of this effort, and I'm excited to be a part of the conversation.
Oh, great. It looks like Dr. Scout has joined us.
Hooray.
Hi, Dr. Scout.
Hi, sorry about that. Google was, I don't know, Google was icing me out. I'm not sure why, what I did to them.
No problem at all. We did give a brief introduction of each of the panelists. Would you like to provide an opening statement?
I'm Dr. Scout, the director of the Network for LGBT Health Equity at Centerlink, the National Association of LGBT Community Centers, and we've been trying to help, share information among LGBT people and the rest of the public health world, particularly about tobacco and now about cancer, for about 8 years. So we are very thankful to you all for having this so we can keep doing that.
Great, thank you. I'm glad to see that Google
Great.
itself. Okay, Francisco?
Hello, everyone, and thank you to the Adrian Jules Foundation for holding this discussion. I think it's been a long road in terms of tobacco control and LGBT, as well as tobacco research and LGBT, and something that we talk about quite a bit is how long it's taken us to get some recognition within the tobacco world and within the sciences of the burden that LGBT folks have associated with tobacco, and a lot of it has to do with the fact that we're still not being fully counted in some of the measures nationally. And that has such an amazing impact in terms of how money is going to get allocated, policy inclusion, and yes, really looking to see which parts of our communities are falling through the cracks when it comes to tobacco control, or we have unintended consequences due to some of our policies that we're passing in tobacco control. So it's multidimensional. I think from all the other communities that we look at that are being affected by tobacco control, the LGBT community has a lot of intersectionalities, a lot of issues where we overlap, and at different levels, and that's key. So it's been a long road. It's an exciting time to go forward, and hopefully we can make some more inroads.
Great, thank you. And Bob?
Well, Francisco was just talking about going forward, and I've got to go back because I remember I was in Maine, lived there for 30 years, and I think my first introduction to LGBT tobacco control was coming out as a gay man and walking into a gay bar in Portland, Maine, and what did I see? I saw a whole lot of smoking going on. And I immediately had a concern not only for my own health, but for the health of my brothers and sisters. And I think that's been a lot of the motivation. And as I moved to San Francisco, I've been lucky to connect with actually people on this panel. This is kind of a fun reunion,
Right?
as we met each other through the years. And I started doing this work, I guess, back in '93. So it's been a long time. I hope that we can make a difference with people who are joining us today, and thanks everyone for being there.
Great. Thank you all again. And I do want to remind those who are watching that this is an organic conversation. I will facilitate the conversation by asking questions that we've prepared and that we've received through social media. So if you do have additional questions you'd like to ask, please feel free to do so by tweeting @AddictionInCorp and using the hashtag LGBTtobacco. And you can also post questions to the Google Hangout event page, and we'll be tracking that throughout the conversation. So with that, I would like to begin by addressing something that I think is very fundamental to this type of a conversation, and that is that the LGBT community is not a monolithic group. Bob, this is something that you did talk about in your paper, but that it's a group comprised of various sub-communities that are diverse in themselves in race, culture, and class. So Linda, I wanted to see if you could begin by talking about why that recognition is so important, given that you do work related to the overall wellness and health of the LGBT community.
Right, right. We do a lot of cultural competency training and across the state of Georgia, and I am surprised of the number of folks outside of our community who picture Will and Grace or Ellen DeGeneres when they think of the LGBT community, and we do. A lot of our conversations involve the fact that there's not one single LGBT community, but there's a host of communities, and the messages that we need to put out there and the work that we need to do has to address those different communities and overlays. We see that, I'm sure it's true across the country as well, but here in Atlanta we see great division along the lines of race and gender, of age, of education and socioeconomic levels, and increasingly of geography, of the folks that are inside the metro area as opposed to those who are living in more rural parts of the state. And the messages that we put out there have to be crafted to reach each of those audiences. And for example, we are at a place where, as an organization, I've got people in this situation, particularly women, who are very angry at us right now for messages that we put out using the word lesbian. And what's interesting to me is that we have older women from rural parts of the state who are offended by that word and are not wanting to be outed in their community. And we have younger women who are offended by that word because they see it as old and archaic and not fitting who they are. And so we have to work to sort of shift within each of these various communities across the board to shift these messages. So I think that's a great place to start, Lindsay, is the fact that we're not all one, and we for sure are not all Will and Grace.
Yeah, if I could just jump in with a visual, I think the rainbow is a really useful symbol to remind ourselves that we're all under this umbrella. And oops, look what's one of the stripes of the rainbow. It's a cigarette. What's that doing in there? So
that's pretty good.
Well, yeah, I think, Linda and Bob, what you guys just said is key, and the other piece to this whole thing is the issue that when we look at LGBT of color, the intersectionalities or the where populations come together is becoming more key in terms of messaging.
Right.
George Ayala has a great line with some of the communities where it's gay at play, straight at work, and sometimes I think we haven't done a good job in both directions, reaching out to some of the other communities and bringing them into the LGBT tobacco movement, and vice versa, to really cross-message some of our LGBT tobacco control, so it will hit those folks that may not necessarily be exposed to those messages. So I totally agree that it becomes very complicated very fast, especially how diverse our community is.
Yeah.
Then I think that the other piece is this misperception that LGBT folks are rich, which is far from it. And if we know that tobacco gradient in terms of tobacco use, and that low income communities are experiencing higher levels of tobacco use. I think the report from the Williams Institute that was released a few months ago around looking at the wealth disparity within the LGBT community is key to where we may need to look at some of our messaging, and once again, cross-platforming with some of the other movements that are going on in tobacco control, because we're not going to be able to address everything, everyone, and it gets pretty complicated. In a good way, I think.
You brought that up, Francisco, because that is something that I plan to ask about as we continue this conversation, so thank you for that. Dr. Scout, did you have anything to add? Dr. Scout, I think you're muted.
No, I'm good. Actually, I was going to let them take that since I know you have a lot of questions.
Okay. Okay, great. So I did mention that the title of our Hangout came as a result of the viral infographic that the network did produce. And I wanted to see if you could touch on some of the main causes of why those statistics were as high as they were. So for example, that the LGBT community smokes at a rate that's 68% higher than the rest of the population. Also that the LGBT community spends $7.9 billion on tobacco products each year. Why are these statistics so high?
Well, if you're not familiar with tobacco, the way people start, we first have to understand it's really a pediatric epidemic. If you can make it to the age of 21 without smoking, you're usually scot-free. So we unfortunately have a really bad overlap between when people start to realize that they're LGBT and very different, and also when they might potentially smoke. You put those two things together, and they often happen in adolescence for people. And since they happen in adolescence, then that unfortunately means that this really is we're high likelihood of looking to something that might help us deal with the stigma and alienation of realizing that we're LGBT. And one of the easy ways to do that a lot of people use to deal with stressors is to turn to cigarettes. So this really is just a story about stigma, 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 and stigma. Outsiders, and one of the common things that people use to try and cope with being an outsider, matching themselves. And then, of course, why the dollar amount is so high. Well, we released that dollar amount for the first time on that infographic, and it really was, I think, a shock to a lot of people. We literally spend so many more times on cigarettes than we even spend on our own civil rights, which is, I know, has outraged a lot of people. Mm-hmm. But tobacco is one of the most addictive things we have in our society. So once it's got its hooks in you, you're gonna spend decades trying to quit, and all that time you're gonna be shelling out money every single day to get more cigarettes. So the hard truth is, if you've got a disparity that starts in the teenage years, then we've got the rest of our lives that are going to be trying to get that disparity down. And even worse news is, we still see a disparity that big among today's youth. So unfortunately, the current gap is set to keep going for decades in the future.
Linda, I did want to ask you, how has this disparity, how have you seen it in your work? Because you've really responded to a shortage of healthcare providers that cater to the LGBT community. And given this type of disparity, how does that affect the health initiatives work?
Well, we were lucky enough in 2011 to pull on Scout's expertise and actually do a study, an initial assessment of LGBT tobacco use here in the Atlanta area. And I don't think that we learned anything that surprised Scout and the other experts. But we did learn that about 30% of our community actively were smoking at the time of the survey, and that number was significantly higher with younger people. And when we asked individuals in the community to rate tobacco as a health concern or health risk, it was 7th or 8th out of 10 concerns in our community. So there's a complete lack of awareness in our community that it even exists as a health issue. And there is, I still don't completely understand this, most of the folks in our survey did not allow smoking at home, inside their home, even the smokers. So they appreciated the clean air space, but they didn't connect tobacco as a health issue or a problem for our community, and they did continue to smoke outside of their own homes. So there's some disconnects in how we look at this issue, and there were several individuals who talked with us about issues of seeing smoking as a right that they didn't want challenged or given up. And so we're dealing, as a health initiative, we're dealing with kind of the aftermath or the results of years of smoking, particularly with the seniors that we work with. Through our health fund and through our referrals, we're dealing with kind of chronic illnesses and issues that we're having to deal with on a regular basis. But still, not a recognition in our community that smoking or tobacco is an issue.
And can I note, we do have information directly from the tobacco industry that they have actually taken our own consultants, figured out how to message to us, and one of the big messages our own people told them to do was say it's a right. You can't,
Yes.
get your laws off my body, and that includes tobacco too. Unfortunately, when we say laws off our body, we're talking about our civil rights issue. Mm-hmm. But when the tobacco industry says it, suddenly it's, the right to sell us death. So that's hard.
Yeah.
I also found in some of the research that I was doing that being directly targeted by big tobacco almost was seen as a positive because it represented inclusion. It represented social acceptance. Can you talk about that a bit?
It's surprising for me that organizations in Atlanta have not received great amounts of tobacco money. Our largest Pride event has not received tobacco money. So we haven't seen, at least here in Georgia, we haven't seen an influx of money and support. We see the messaging, and we see the targeting in the bars and in the social situations. But I hear of that big money, and I've had conversations with the executive directors of other nonprofits who have said, if they offered it, yeah, I'd take it. We need the money, and I would take it, and I would try to work against them with it, but I would take their money. We haven't had the opportunity to actually have that conversation because the money hasn't been offered here. It'd be interesting to hear what happens in other parts of the country.
And one thing to note actually is sometimes the money's pretty well hidden. Like, for example, HRC, which has a big health initiative for LGBT community members around the country, just went out and did a big event in San Diego. And at the event that they were at, they had the tobacco industry there. So that you'd think would be directly against HRC, but it's happening because the tobacco industry has pre-negotiated contracts with the bars in San Diego to make sure they can be at any event they want that the bars ever throw. So there's ways sometimes that this kind of money influence in our communities is hidden. But it absolutely is true that even if you don't see the money, the community members are grateful that they're advertising to us because we know there's a history of people not advertising in our magazines and newspapers, and many of them have had to fold. So we're grateful for any advertisers, and that's pretty sad when, we'll even take the tobacco industry.
Mm-hmm.
Bob, what has been your experience with this in San Francisco and in California?
Yeah, well, again, going way back, talking about that history of targeting and tobacco and alcohol companies. Actually, if you find old issues of the Advocate, if you looked on the back cover, pretty much guaranteed that it was going to be Absolute Vodka on the back. And that built an affinity, a kinship with the community, craving for acceptance, frankly, looking for not to be scorned, but actually to be accepted, and it was a smart marketing move on the behalf of that company. Can you all hear me and see me?
Yeah.
Okay. My screen is doing a lot of dances and things, but I'm not going to worry about that. I'll keep going.
Okay.
Now, in terms of the first marketing campaign that was advertised toward gay men, it was 1992, and that was in Genre magazine, which no longer exists, and that was Benson and Hedges, Special Kings. And actually, a friend of ours named Kevin Goebel, who was a member of CLASH, the Coalition of Lavender Americans on Smoking and Health, published a paper. It was called Lesbians and Gays Face Tobacco Targeting. And he really alerted the international tobacco control community. It was in that was about Virginia Slims and the campaign that they were running. So there is this history, and what Scott was saying, it's so true that we've had community members, LGBT community members, who've been paid by tobacco companies to spin this issue that we see as a problem. They spin it in the direction and in the favor of the tobacco companies. And specifically about that first ad that ran in 1992 in Genre, the Benson and Hedges Special Kings, it was exactly the strategy, and we have the documents to see this. So we're not, I don't think they ever expected that we were going to see all these tobacco industry documents, but we've seen them, and the Legacy Center at University of California, San Francisco is a place, and people online can search for all of these. But it showed that a certain community member had said, you know what, I'm not worried that the gay male community is going to react negatively, because what we're going to do is spin it and say, look, without this double truck full-page ads, 2 pages in your magazine, you might not have as many great articles, and the journalists wouldn't be paid if it weren't for us, benevolent advertisers, supporting your community. And it was effective, and that advertising continued through the years. And I just got to say, walking to my Google Hangout today, this is the cover of San Francisco Weekly, which is an alternative news weekly, estimated, I think, about 30-35% LGBT readership. And it's hard to see, but the graphic says closed, and it shows martini glass, and basically the title of this article is "Gay Bars Are Disappearing. Does the Success of Gay Rights Mean the End of Gay Culture?" And it's a really wonderful, in-depth article. But as I was turning to read it, I turned to the inside cover, and there's made with organic grown tobacco, grown on American soil, 100% additive-free natural tobacco. So and there's the warning label, and yet, this is still part and parcel of what the industry is doing. And back to the monolithic comment, we cannot afford to think it's will and grace. We certainly cannot, because our tobacco companies have not been thinking that way for years and years. They are micro-targeting us. And on the network blog, I believe I saw from, I always mix his name, it's, help me, Scout. Is it Juan Carlos Vega?
Yeah, Juan Carlos, yes.
Yes, so he just recently blogged in, or a month ago, I believe, about the 2 events from Benson and Hedges in San Juan, Puerto Rico. So doing targeting in the bars on the island. And I like to think that we've pushed them out of California, but I hate the idea that they're finding other places to go. And certainly they're doing a lot of their work behind the scenes, with direct mail, and also yes, direct mail, and certainly online. So we might be seeing less of the evidence, but there's a lot happening behind the scenes still.
And you haven't pushed them out of California. That San Diego event was just actually a couple weeks ago, sadly.
Yeah, exactly. And there was a history, too, in the mid-2000s, certainly, of Philip Morris. They called it their philanthropy campaign, and you were able to go on their website and look at all of the organizations that they were funding. And one of their targeted groups to help and support with their dollars, and this money was accepted by executive directors who unfortunately didn't have enough dollars to go around, and they were prey to this money, understandably so in many cases. These were AIDS service organizations, specifically those were dealing with hunger, so the AIDS delivery service organizations. And yes, there was one in San Diego, one in San Francisco, one in Los Angeles, and I believe in New York City and other places that were accepting this money. And the tobacco industry is famous for giving a little money here and spending 10 times or even 100 times more to tell the world about how generous they were with that little donation that they gave. And it's absolutely atrocious what they have done and what their history is and continues to be.
As we often say, we're sadly a cheap date for the tobacco industry. I wish we weren't, but it's true.
It's true.
Now, how do you begin to tackle that issue when you are dealing with an industry that is so connected in terms of the funding of these organizations? What can the LGBT tobacco movement do to reduce their clout?
Raise taxes is a great way to go. We know that for every 10% increase in the price of tobacco, we're going to get a 7% reduction in tobacco use. In a state like California that so many other states have a higher tobacco tax, it's only 87 cents. And we know that that money would go toward programs and, for example, cancer research and advocacy and media campaigns that would counteract the lies that the tobacco industry continues to spread. And just the history of that was way, way back in 1988. California passed, they call it the quarter that saved the world. It was 5 cents out of every 25 cents for the tobacco tax initiative of 1988. It's called Proposition 99. And that funds the program that I'm working on and funds many programs throughout California. And we need to keep the pressure on that industry. They have so many pennies to our few pennies to do our work.
And one of the things we do, I'm sorry, go ahead, Linda.
Well, one of the things that I think that's important is that we show up in the mainstream conversations. So here in Georgia, when local counties started taking on clean air and the possibility of increasing tobacco taxes within the counties, for us to show up and represent the LGBT community and say we're at the table, and we're ready to support the effort, and we're going to do our part by bringing the bars and engaging in those conversations, then we get counted as an ally, and ultimately the result is that we get more support and we're recognized as worthy of sitting at the table. So I just add that to the mix.
And as I was going to say, one of the things we do is, like Linda talked about doing the needs assessment, we're working with a lot of other communities now to do needs assessments. We took kind of the way it had happened individually in Georgia and some other places, and we made a bit of a national model now, which is open to community centers around the country. So I literally just got off the phone with a bunch of community centers in Michigan who are for the first time smoke. Because when we haven't been part of the national data collection, we have to collect it ourselves. And I'm sad to say that we looked at some preliminary findings, and we still realize, just like in Georgia, the prioritization of tobacco is something that kills us is still just as low as it was when Georgia took the information too. But we spent a lot of time doing that, and the needs assessments are a great way. If you're interested in having a needs assessment in your town, you can contact us because we can work with your local organization to do one. And then we also spend a lot of time with the state tobacco programs, encouraging them to include LGBT people more, to fund LGBT organizations like Linda's, like Bob's, do that directly in the local area, because we are a group of people who've had so much discrimination and so much stigma, and it's often from the government. So the truth is, if the government are the people who are funded to try and change this, we're not going to trust them. You know what I mean? So the best way to actually build that relationship, which has often been really fractured, is to directly fund your local organizations. They know how to get to the local people, and you can trust them to do it well.
Yeah, if I may add, I think that the other piece is in terms of, a lot of organizations, in terms of tobacco, but one of the things that we're facing with is competing priorities. And, let's just be real, tobacco control is not a sexy issue. It's not HIV, it's not breast cancer, it's not going to have the traction that other issues have in our community, but yet we in terms of tobacco control, sometimes we have to take a step back and say we're really dealing with competing priorities. So how is it that we're going to dialogue with some of these organizations that are working in other areas that interact with tobacco or intersect with tobacco, and sometimes it may not be that tobacco control is the first thing that's addressed. But because we're at the table, as Linda said, it may be the second thing that's addressed. But at least we get a foot in as opposed to always competing with each other in terms of our priorities. And I think the tobacco industry has done a very good job in realizing that wedge, that unintended wedge that's created through our lack of funding and exploiting it. And the reality is also that they have billions of dollars compared to the amount of money that is marked that is tagged for tobacco control in the LGBT community, if it's ever tagged. There's some parts of this country where there's no money that's say this is for LGBT tobacco control, and there's some other parts of this country that I would hate to say that they're leading, but compared to the rest, they're doing a little bit more. So the tobacco industry, the other issue is an issue of resources, that they've done a very good job, and they have billions of dollars compared to what we have in order to fight this multinational organization.
I love what you were saying, Francisco, about probably tobacco is not considered the top priority for many people in our community, and especially some of the more challenged community individuals. Some of those other issues are going to be, housing and violence in a neighborhood, for example, or certainly racial discrimination or other stressors and so forth. And what it's led me to understand, we have a free quit smoking class called The Last Drag, and that started also in 1991 with the San Francisco Department of Public Health and continues to this day. One of the things that I've really been trying to listen for is that as people come in, of course, their feelings are mixed about quitting as individuals. And one of the reasons is, for years, I've been thinking of this as, tobacco use is a problem. Well, what I'm starting to understand is, for them, tobacco use is a solution. They say, this is what gets me through the day. This is when I don't have money for food. It's the nicotine that makes me not so hungry anymore. Homeless people are using nicotine as an appetite suppressant. That type of thing, like tobacco works for them. It's so useful, if it's socially acceptable, if it's a habit that works for them, it's a calming influence. Gloria Solis, who started The Last Drag, talks to people in our class about this, your relationship with tobacco. Have you ever considered it might be the most, you've lived in different places. You may have had different girlfriends or boyfriends. You've had different jobs through the years, but have you considered this might be the most long-lasting relationship that you've had in your life? And then it might be the most intimate relationship that you've had in your life.
To follow up on that, we did receive a question from someone who's following on social media, and they're curious about the percentage of LGBT smokers who quit annually. Does anyone know that statistic?
It's almost impossible for us to answer so many data questions just because we're not collected in the surveys. So the amount of data we have is just one of our biggest barriers. We'd love to say that. We know that about 70% of all smokers want to quit, and we know that practically a third are trying every New Year's Day. So we presume is going up and up. We just don't know what it is.
I don't have an answer to that. Does anybody else? But I had a comment if nobody else has a figure.
No.
I was just going to say that, in terms of, are LGBT smokers different than non-LGBT smokers in terms of their quit behavior? More than likely not, because the body chemical properties of the addiction. But I think what we may have different triggers and for relapse, and we may have different triggers that may not be addressed by traditional smoking cessation classes that are particular to our community. And as Bob and other folks have said, there's a lot of reasons why people smoke, and sometimes we're not as cognizant of the lived-in experience that LGBT people live with that make it even harder to even think about quitting or staying quit once you try a quit attempt. For example, some of the studies that are coming out around the amount of violence that still a lot of LGBT youth experience in their schools, and those are the kids are in school, is astronomical in areas that you would think come on, it should be a little bit less. And I know we've been doing some work with San Francisco Unified School District, and the amount of violence that queer identified kids are experiencing on a daily basis in their school, it's scary. So there's still the reality of the lived-in experience that LGBT folks are having, and what does that mean for somebody to make a quit attempt, or even somebody once they made a quit attempt not to relapse because of the lived-in experience and the daily assault that you get just by being an LGBT person. And then we know within our 4 letters, there's different levels of lived-in experience. Whether it's transgender community versus one of the other letters.
Bob, you had a comment, right?
Bob?
Hi, I'm back.
Okay.
I was struck by some statistics about middle schoolers in the San Francisco Unified School District. I heard this a couple of years ago, and we've started to incorporate it into our last drag class. Of course, people are there to quit smoking as an individual, but we really want to build in concern about people who are different from themselves, that it's really not just about me, it's about our community and about hearing about others who might have a different path in their lives and bringing everybody up. And the numbers are absolutely astounding for those, for example, who identified. And this question was asked, and this is why we know this information, is that the San Francisco Unified School District does ask gender identity question as well as sexual orientation question. I believe they've been doing it for 11 years, and I think Alameda County, another county where Oakland and Berkeley are located, was going to start. But again, we can't have this data unless we ask the questions, as Dr. Scout was saying.
I want to address that and also address something that we touched on a bit earlier as far as youth smoking rates. There's been this sort of cyclical process, it seems, of where you need to first start with working within the LGBT community and those sub-communities within it, in this case youth, to first explain and get these members to really understand the scope of the disparity before you can then begin to work outward. So what does that look like in terms of how we are engaging youth and encouraging a preventative approach to tobacco?
I would have to say that we try and keep tabs on the types of programs that are going on around the country. We can't really create them, but we try and keep tabs on them. And there are many fewer youth programs. As a matter of fact, we lost a lot in recent years. So I'm sorry to say that I think that this is one of our biggest areas. Have to have funding that direction. We do have a new horizon that's just about to start up, and that's that the FDA gave a very significant award, tens of millions of dollars actually, to an agency to do youth marketing against tobacco, targeted the LGBT communities. So that could really change the world as they get up to full speed and really start to roll some of those resources out. Because right now, this is more of a gap than it is a need. There's so few programs going on around the country.
And I think that the piece that I would add to what Scott just said is that when we think of queer youth tobacco use, I think we need to realize that we're talking about 2 different populations within queer youth. One is a population that we have very little data on, and we know the disparities are there, and that's the school-based population. Those are the queer kids who are still in school, and in the 17 school districts around the nation that ask sexual orientation question, at least we have some data on them, or even the local surveys that do that. But the other reality is we have a significant percentage of queer youth who are runaways, homeless, who are not part of those surveys. And we know that their risk is much higher. So what does that mean in terms of tobacco control? What are the tobacco control campaigns that we have right now? Who are they really targeting versus who's being left out? And some of the homeless and runaway youth surveys that have been done, they vary in terms from 25% to 40%. of the youth counted happen to be queer or identified, those are astronomical numbers. So, yeah, I think sometimes when we say what are we doing for queer youth is we really have to think of two populations, and one that's easily addressed, and the other one that, for all intended purposes, through every system is falling through any safety net that we have, and at times they're the most vulnerable. And I would guess, we don't have the data, but I would guess probably they're the ones that are smoking even higher, at higher rates.
Just to point out, I'm not selling this, I don't get anything from it, but we really did put our heart and soul into it. This was, let's see, it's pretty colorful 42-page booklet that's called The Last Drag. It's a quit smoking guide for young adults. And it was developed with some young adults actually in Orange County, and then we were able to apply some graphic design and test it with youth and just make sure that it was something that they would use and so forth. We can't have a program in every community, but it is something that I was thrilled to read that a young man in Ireland had purchased a bunch, and he just started his own group with his friends. And they started quitting and helping each other. It's an interactive kind of material. It's available from the Tobacco Education Clearinghouse of California. And it's just a modular way that people can, as an individual or a counselor, can hand this to somebody. And it has inside, for example, some of the things that people struggle with, which is looking at their lives, thinking about when they're using tobacco, or is it when I'm, mostly when I'm frustrated, is it when I'm happy, is it when I'm bored, is it all three? Unfortunately, nicotine is a solution for all three of those emotional states, and so versatile. So it's a beginning that young people who, many would love to free themselves of tobacco if they've already started, but most, many will not really strongly consider moving into that action phase until later. But we have an opportunity to catch people as they're contemplating the role of tobacco in their lives, to think about, is it doing for me what it was when I took my first puff or my 100th puff? Is it still working for me? Or maybe there are other things I'd like to do with my extra time or my extra energy or my extra money that I'd have if I could free myself from this. Certainly, as we educate about the tobacco industry influence on many people, especially people of color, what I've seen is that people are really angry when they read some of the quotes that tobacco companies have said about their communities and how they've used them as pawns. And I think that there are a lot of things that we can do, but I agree that the focus has not been there. It may just be, I'll tell you personally, we've often approached youth-serving organizations in the LGBT community, and we have certainly said that, it's a youth-directed program. Unless the youth name it as an issue, they're not going to discuss it. So I don't mean to blame them. It just means that I need to rededicate myself to keep working and keep trying to keep those doors open for more work. And so I'm excited about possibilities to do more inclusion of young people. And that statistic that we've had for about a year, I think, Francisco, I think the number is 29% of our homeless adult population was identifying as LGBT or queer. And I believe I just heard a gentleman who's running for assembly member quote a higher number. I believe it was something like 40%, and forgive me if it's wrong, but of our homeless youth were identifying as LGBT or queer. So the numbers are absolutely staggering. We just have to keep that in mind. Now that we have the figures, we cannot have any excuses to not move forward with that. So it's truly on my mind today as we're talking about this.
One thing that we know is popular among youth who do smoke, among other populations, is, of course, e-cigarettes. And I'm curious to see if you all could comment on how you've seen the tobacco industry market e-cigarettes, and whether it's similar and or different, what you've seen in terms of how it compares to the marketing of traditional cigarettes.
Well, we know that a lot of people are talking about at least e-cigarettes. When they first came out, they came out as the alternative to cigarettes, right? You can smoke them, or you can smoke cigarettes, etc., etc. But recent studies that have come out in the last few months are showing that people are really doing dual use. It's not that they're choosing e-cigarettes over regular cigarettes. is that most folks are actually doing both. So it's very interesting, the marketing campaign that the e-cigarettes companies have done, which we know a lot of them have been acquired by Big Tobacco in a way, or Big Tobacco started their own e-cigarette lines. Then you also have to look at the circular that FDA put out that's talking about some of the harms associated with e-cigarettes, what we know very little of, given where research is right now. So this idea that e-cigarettes are safe or safer. They may be at some level, they may not be at some level. Definitely, we need more science. But going back to your question, that they've been marketed as the alternative, and we know that smokers are not choosing one or the other. They actually dual use. So the whole issue that is an alternative that you can quit regular cigarettes, that at least the research is not bearing that out.
And we also know that, I mean, if you've ever been to one of these vaporiums, that, unless cotton candy flavored, nicotine is, or cotton candy flavored, e-cigarette juice is actually going to appeal to adults. A lot of the way this is being structured, you take electronics, you add the kind of flavors that we know kids are really attracted to, then you all put it in kind of a wrapping of a Starbucks kind of, coffee shop environment. And I think, this may work for some. There are absolutely individuals who have testified that this helps them cut down on cigarettes. But the big concern isn't that it might help a few individuals who are adults cut down. The big concern is that it might be incredibly enticing to a whole new set of youth, and then it's going to take us decades and decades to get them off of it. So it's kind of like you're going to have the people who are incredibly adamant, this does help the adults, but it's really like the wild, wild west. There's no regulation. These, stores are all over the place right now. As little as a tablespoon of it because they're touching their parents, stuff from the e-cigarettes. And then but that's what you see at one end. The real concern from the public health environment is what's going on with our youth. And of course, as we continue to have vulnerable LGBT youth, I'm really afraid that in 15 years we're going to think to ourselves, oh, we should have stopped it as soon as it started. And we won't know until then. But there's some signs showing that's where we're going to be.
Yeah, and if I can add to that as well, and the fact that, I guess one of the concerns that I have is, are e-cigarettes a new shiny disco ball that's been put into play? And are we losing an eye on some of the other tobacco products that are out there that we know? For example, some of the communities of color, little cigars and cigarillos.
Right.
A big thing. These are. And in some parts of this country, they're even bigger than other parts. But if you look at some of the national dialogue, some of the funds, what's being studied, a lot of it is going to e-cigarettes, while some of the most vulnerable populations that we know use little cigars and cigarillos at high rates. That conversation it's been muted. So, and I don't think it's either or, and that's the challenge for us in public health. How are we able to maintain what we know is not a single track that the tobacco industry does in terms of marketing their products? They're going to market their products through multiple tracks to different people who, they've done the market segmentation. They've done the market segmentation for our community. So therefore, how do we make sure that we're not distracted by one thing over another? And how do this is where the data becomes critical in terms of how are e-cigarettes penetrating the LGBT community and at what rate? And the reality is we do not know.
So this is clearly no easy task. And Dr. Scout, you were talking about this possibly reversing a decade of work and activism. I'm curious, for each of you, what is it that keeps you going, knowing that this is there's such strong opposition?
I think first thing that keeps me going in this, I would have to say, is a lot of the other people on this webinar. I love the people that I work with. They're some of the most devoted people to the public health of my communities. And if you ever had any idea that that you're being targeted or manipulated, our dreams don't even come close to the reality of what's going on with the tobacco industry and the LGBT communities and all the other communities we're targeting. So, we know that we've got someone who can run rings around us with money, who can run rings around us with all other resources, but every single person that I know knows someone who's died from this too. So you've got something huge at stake. And every day, we may be working against insurmountable odds, but I guess it only means that we're too stubborn-headed to give up, because every day we are making gains. People are giving up cigarettes and e-cigarettes, cigars, cigarillos, everything. And every single one of those that they finally set down is, another person that we've helped walk away from dying early because of it.
And I think Scout's right. I think that for me, it's the individual stories. It's watching each individual success and celebrating that. One of the things that has helped us a great deal locally is Facebook, and celebrating the stories as they go day by day smoke free, and as it stretches into months and years, and watching leaders in the community jump on the bandwagon in supporting others folks. And that's what keeps me going, because there's no money in this fight here, I pull on the resources of folks like Scout and these guys, and count on one life at a time.
Francisco and Bob, did you have anything to add?
Bob, me or you?
Oh, I'll go. Well, I'm so thankful that, in 2006 that the National Network came on the scene and brought wonderful programs that were happening in little parts of the country together and connected us with listserv and connected us through a compendium of programs and research that we could, have sort of a there, if you will, for what's happening. And I'm so grateful for that connectivity that, frankly, we've had in California. In California, we've had a connectivity with our people of color tobacco control organizations, and we continue to work together, and the researchers work with the advocates, so we can take that research and bring it to the street. And I think we've had that connectivity, but it's been so exciting, and it goes beyond our borders, right? Because we were at a international tobacco control conference years ago, and there was a young gay physician from Kyrgyzstan and people from Australia and from Canada as well, and we're exporting. Our tobacco companies are exporting addiction, death, and destruction in the name of one of the most famous brand names in the world, not Starbucks, Marlboro. And we really have a social justice responsibility to rein this in. It's harming our small circles of people, our LGBT community, but it has really been a destruction on the world. We know it's largely preventable, and I mean tobacco companies are largely preventable, except there are things like Supreme Court that get in the way. We can't even get warning labels, graphic warning labels that show the truth of tobacco on our packs of cigarettes, because the Supreme Court gives broad freedoms to companies to talk like individuals and to have, quote, commercial free speech. And so many other countries are ahead of us in this regard that we would be following the likes of Uruguay and Vietnam and Singapore, Canada, certainly, Australia. So I think there's a lot that we can do with policy, and that motivates me to take that step. Let me tell you, electronic cigarettes wasn't first on my list of priorities, and yet, when I started seeing people using them in the fancy shopping mall, and I saw a lot of LGBT youth vaping, right inside because they were allowed to do it, the security guards, who I inquired to, said, "Oh, we're allowed to let them do that because we have a vendor in the mall that's selling those things." And I saw, wow, this is all tied up in money. This is all a social norm that's been developing. And we worked so hard, 20 years, for clean indoor air, and we're not going to roll it back to what it was before. And I'm thrilled that as of April 29th, 4 major cities, Los Angeles, New York, Chicago, and San Francisco, passed an ordinance that says you can use your electronic cigarettes, but only where you can use combustible cigarettes. Wow. Generally, that's in a place outside, away from anyone else that you're harming, because even if the tobacco companies are saying it's just water vapor, well, it's not just the fog. We know what fog smells like in San Francisco. It doesn't smell like that's those chemicals coming out of those e-cigarettes, and you can't harm someone with breathing out nicotine. Back to there's so much more to do. So back to the flavored cigarettes, the menthol. the low-priced Swisher Sweets that are coming out. I mean, 2 for $1. So a lot of communities are working on policy to have minimum pricing, for example. So it's not so inexpensive for especially young people to take up this this habit. And have a lifetime of addiction, whether it's electronic cigarettes or conventional cigarettes or little cigars or anything else. And it is absolutely alarming hearing the testimony at the San Francisco Board of Supervisors hearing on the electronic cigarette policy, hearing about the percentage of what we know of the youth uptake that are. I mean, what a dream for a tobacco company. You see perhaps your revenue is declining with your conventional combustible cigarettes, and what a dream to find a new way to sell your nicotine, and then people will continue to use your regular brands when you can. Plus, you got on TV. So we haven't had television ads. I mean, I'm old enough to remember that we used to have, I think it was Winston, tastes good like a cigarette. I remember those things on TV. And then there was a federal statute law that in the early 70s that banned television ads. But now, you see Jenny McCarthy vaping with her brand on TV, and there's nothing that can be done about it right now on the federal level. We have to work locally. Let's keep an eye on what's happening with the FDA. Let's keep giving our opinions about that. But let's keep working locally, band together, and trade policy ideas, trade tax ideas, trade community education ideas. And eventually we will get there. I started out working in a smoke-free workplace. It was a Holiday Inn. I was a desk clerk. They put down the cigarette and signed the register. A lot of us may have experienced flying on a plane with, this no smoking section, those little dotted lines, on the planes. Remember that when the smoke was supposed to know to stop at the no smoking section? So we've made tremendous gains. Frankly, we have changed the social norm with many of our more affluent communities. It's not Mad Men anymore for whites, for males, for people of means. But we really have to dig in and make sure that we lift everybody and keep going with that. And if it means getting out of our offices, getting into the communities and learning more and talking with each other, that's what we need to do.
Friends.
So I'm still motivated.
You what? I'm sorry?
I said, so I'm still motivated, and I think I'm still kind of angry about all this. I've lost 3 relatives. I got to do it for them. Great-grandfather was, when I was 10 years old, on a machine trying to catch every breath with his emphysema, and it shouldn't happen. And I put a lot of responsibility on the tobacco companies that continue to do what they do and what they've done, and they're still doing it, and they're always steps ahead of us.
Yes, and I think that's the case for so many people. It provides that momentum in that everyone has known someone personally, directly or indirectly, that has passed away or received some sort of tobacco-related illness, and that is, I think, a part of what keeps people going, despite this strong opposition and challenge.
Mm-hmm.
I did want to address another question that we received through social media. Bob, this is going back to what you were talking about with the Last Drag. It says, how does the Last Drag cessation program differ from the American Lung Association's Freedom from Smoking?
Well, of course, the American Lung Association Freedom from Smoking program is very fun. But I like to think that we have a little more fun. We really made it a little more culturally relevant. So we play a Jeopardy game, and the categories, first they get to name themselves as teams, and there's a little friendly competition that happens. What we're realizing, I think, is that it's not just about, who wants to go to a class to quit smoking when there's something else that's more fun that they could be doing. But what a great opportunity to walk into a community center, meet some new people, find out that you're not alone, find out that there's a diversity of people who are struggling with this issue, and find that support, and actually have a lot of fun doing it. So we have some activities that are specifically geared toward our community that take what the American Lung Association model has been doing. We have a memorandum of understanding with the American Lung Association to use that gold standard group support program. But I think three things perhaps: who the facilitator is, that they're familiar and comfortable and hopefully a part of the community in some way, that you're in a venue that is comfortable for people to walk in, where everybody can enter and have access to, and then the program itself, that the process is respectful, might have some extra humor in it, because that's a value that hopefully we share and continue in our communities, that we like to laugh at ourselves, at each other, and maybe we see things slightly differently from the broader community. And if we can keep some of those things going, oh, voila, lo and behold, people end and they've actually dropped their cigarettes. And we have a lot of people, I wish we had 100% success. We don't. But we do have people who tell us at the end and say, you know, I came in this class and I wasn't expecting to quit. And that's the most beautiful thing to hear, when you get a thank you from a person and you see them on the street. And sad news is, the recidivism rate is huge. So we welcome them back. If they go on I just sort of joke, don't go on any Olivia cruises. Don't go on any LGBT cruises. Don't go to Europe, you know, because that's how sometimes people get right back on those cigarettes. And if they want a refresher and get that support again and help quit, there's not one way to quit, right? So it's real individual. But it gives people an opportunity to dig into themselves and figure out, is this working for me anymore? Or what we hear from a lot of people in our community is, I'm sick and tired of being sick and tired. And that's what motivates them to make a step toward trying to quit.
And if I can give a shout out too, you know, the American Lung Association has done a lot to try and help make sure that their programs are welcoming and put out custom materials for the LGBT communities, which is a real help, because that means freedom from smoking is available around the country, when, of course, Bob's program is only San Francisco based. So, you know, that at least gives us some resources in some other parts of the country. There's also a lot of quit lines that have done a fair amount on training their counselors to be LGBT culturally competent. We're actually going to go out and train a quit line that does about 6 different states in another week now. So people are understanding that this has got to be a priority for them. They can't treat everybody the same on our end, mostly because the tobacco industry is not treating us the same as everybody else. So, of course, the tobacco control industry has to step up and use a little more advanced methods in order, they can turn that tide.
Would you be able to say the national quit line for individuals who might be interested in being connected either to their local quit line or to support for quitting smoking?
Yeah, absolutely. If you're smoking yourself, whether you're LGBT or not, we really do recommend that in most places your smartest first step is to just call 1-800-QUIT-NOW. And then it's actually National Jewish, the one that we're about to go out and train, that is a quit line service provider for about 7 states. So, you know, we are seeing more and more providers care about making sure that the people on the other end of the phone are culturally competent, are treating us well, which is good, because actually, as I looked at those data from the Michigan Needs Assessment, we found out that about half of the LGBT people who are smokers fear the response they're going to get by calling the quit line. And of course, that's a huge barrier to quitting then. If half of our people are like, they're not going to treat me well, then they're not going to call, you know, so we need to really, it's one of the things we need to change.
Yeah. Also, if the person wants to explore without making a telephone call and they're more comfortable online, a great site that you can explore is from our friends at Legacy. It's www.becomeanex, so that's BECOMEANEX.org. Right. And there are quitnet.net is another great site. It's a community of people worldwide who are exploring quitting smoking together. Great resources there. So there are resources. Anyone who's lost, go into your local library. They're still there. Those librarians, ever since Google came on the scene and everybody can search everything themselves, they're actually trained to help people out. So walk in, they're kind of bored. It's like the old Maytag repairman that people might remember, because Maytag washers were so good that those repair people weren't seeing many people inquiring for them. But those librarians are there to assist and help, and I think there's a library in every community where everybody is watching today. So get some assistance, and if you want to help a family member or a friend, it's hard to do because it really is, they're in the driver's seat, if you will. They have to take those steps, but you can make an offer that you're going to be patient, you're going to be a non-nagger, you're going to be there with them through the process, and it would be really great if you would educate yourself first so you know everything about what it takes and what someone's going through when they make an attempt to quit smoking, and then you really have the empathy, and you've earned the right to help your husband, wife, partner, spouse, parent, child. You've earned the right to help them, and then you might actually be a little more patient because you'll see that it can really be a struggle for a lot of people to quit. We have to be gentle with people because tobacco, as Scarlett had said before, it's a really insidious. Nicotine is insidious. It works so well, and we have to allow for people to have many opportunities to quit. One last thing, if I could, while I'm on this long sentence, is the Affordable Care Act. So if people have found an insurance plan or Medicare, there are more ways now that people can access medications, if that will be helpful as you work with your pharmacist or with your primary care provider. And there are certain codes that can be used by, to access more support for quitting smoking.
Good point.
Linda, earlier you mentioned Facebook, and each of the panelists in some way has mentioned partnership, and Bob specifically, you said going beyond borders. Can you talk about how the new media landscape has affected LGBT communities and organizations' capacity to combat tobacco use?
I think it's provided us more opportunities for connection, and these guys would have other examples, but for us in the community here in Atlanta, it is allowed us to connect with and friend and share messages of mainstream, of the Lung Association, of the Heart Association, of the Cancer Society, of the National Organization of African Americans Against Tobacco Products. I'm not quite sure of their acronym, but as it's allowed us more opportunities to partner with those organizations and share their messages and incorporate them in our messages, and so it's given us more bandwidth, I think, in some ways, as well as given us relatively easy ways for individual community members who may not have the opportunity to come into community centers or see folks face to face to join in those conversations and feel a part of supporting and or asking their questions as they each struggle with quitting or supporting the folks around them who are.
Dr. Scott, I know the network uses an online web presence in its efforts. Can you talk about this or address this question a bit also?
Yeah, well, media is changing so much nowadays, and nicely, a lot of the new media is free. And so that's interesting, but it's also a challenge in figuring out how to do it. One of the things that we've done recently is, we originally started our own blog. And then, because we've been doing a lot of work with our own blog, at one point, one of the bigger media presences in the LGBT communities is Huffington Post Gay Voices page. We went to them and we said, you should do more right for us. And so then we started doing that for a while. And then after a couple years of doing that, we actually pitched to them, why don't you guys start your own LGBT wellness page? And I'm really happy to say that they said yes, and we've kind of been working with them now to help edit that page and get posts for the page. And one of the things we do is every single week we give an LGBT wellness roundup of the top stories that week, like 5 to 8 of the top stories that week, which of course, whenever there's a tobacco story or a cancer story, we make sure it's in. So, there's a lot of ways in that, we're kind of coming at it sideways, but it's all part of spreading the message. And, like Gay Voices gets 80,000 people going to it every single day, and that's not even counting what's pushed out from the main website. So, if you can't beat them, join them kind of thing. So it's kind of interesting. In the effort to get the news out, we've kind of half become, media entities ourselves in trying to, put all these posts up on other people's websites.
Great.
It's come really a long way from 1991 with 4, tobacco control advocates in San Francisco talking to each other.
Yeah.
Mostly because nobody cared. Nobody else were like, what are you talking about? It took a little while. They had to print T-shirts that said, free lesbian, and you know, hand those out at pride events and those types of things. But it is really exciting. There's a great campaign that sort of run and rerun, and it was created by our friends at let me think. Well, now I've just forgot. So it's an advertising agency, socialmarketing.org, but I can't think of their name.
Better World Productions?
You got it. Better World Advertising.
Advertising, yeah.
And the name of the campaign was Cigarettes are My Greatest Enemy. And this was to highlight the fact that, yeah, with all the issues that we're all concerned about in all of our various communities, you have spokesmodels, and here's one. I'm just going to show it and see if I can read it at the same time. This is Ariana, and she's saying, you know, I didn't survive depression and suicide attempts so I could die from lung cancer. I had to stop smoking. And then it says cigarettes are my greatest enemy.
Right.
These are real people. These are real people. And, you know, Terry was a friend of mine. I hope maybe he's out there listening today, but
Right.
Terry was proud and brave enough to pose as a spokesperson in his story, where he says, I didn't survive crystal meth, so I could die from lung cancer. I had to stop smoking. And he did, and he lent his face to this campaign. So the opportunities now are you can run this in traditional media in our LGBT papers. They're still printing those, you know, ink on paper, and those are being read in our communities. But there's pretty much everybody has an opportunity to run a campaign like this online. Obviously, we know, I don't think we've scored a big, everyone's looking for the Susan Boyle viral hit or the cute cat that, I don't know what the cute cat videos are, but, you know, I don't know if we scored anything viral, have we, Scout Francisco? I don't think we have, but we have the opportunity to do it. And it's just amazing that we all like get this power, that there aren't the gatekeepers of media as much as there were, that we can, one person can just make a difference with a creative idea and getting it out there, and we're doing it. We're doing things like that, and we're going to do more of it.
Well, this is a perfect segue to talk about what we can do. We began this hangout with the statistics that were revealed in the network's infographic, and let's talk about how we can decrease some of those numbers. We do have one question from someone on social media who is asking about a boycott, and I'll read the question aloud. Could a boycott of big tobacco companies by the LGBT community prove effective if the economic effects on the industry are publicized? And is a boycott realistic?
Hello. So my close colleague and friend Naftali Offen, O-F-F-E-N, I would like you to read his research paper. I can't remember the title offhand, but it's called The Perimetric Boycott, P-E-R-I-M-E-T-R-I-C, where he looks at that question. I believe his conclusion, if I can remember, was that we have much better luck if we're going to go the boycott route with informing and educating and boycotting, if necessary, our friends, people who we have influence over, than a behemoth like the tobacco industry that's not going to feel it. Now, I'm not saying it's not worth trying. I'm willing to do it. I am currently boycotting Philip Morris and R.J. Reynolds and any other tobacco company myself by not purchasing those products and anything that they make through the years. Because remember, they used to make Oreos back when it was one big conglomerate. You know, so you couldn't buy anything actually. But they divested in that in the early 2000s. But I think Naftali often makes a great case in the paper of how we would look at a boycott, and I would encourage you to go to your local library if you don't have access, and have your librarian find that research paper. I'm guessing it might have been in the journal called Tobacco Control, or it possibly may have been in the American Public Health Association journal.
Thank you. And now we're getting down towards the end of the hangout, and for our last question, I'd like each of you to please, if you could, share the top 3 things that as individuals we can do today and our viewers can do to really put an end to this disparity.
All right, I'll take dibs. I'll go first. First of all, whether you smoke or whether you don't smoke, be a support team for someone who's trying to quit. Educate yourself, on what is going to be the best way to do that. I actually have a blog link. I'm not sure if everybody can see it, but I wrote an article about how to help an LGBT friend stop smoking, how and why to help an LGBT friend stop smoking, which gives you some strategies and talks about the disproportionate impact. So first of all, be a personal support team for someone trying to quit smoking. You can absolutely make a difference yourself. And second of all, if you've been listening this far, start talking among the people you know about the impact smoking has on the communities. Because right now, we know that the LGBT communities mostly don't even know that we smoke more than others, and until we are upset about this disparity, we're probably not going to activate the power of the masses. And you can have, the four of us and our 25 friends who really care about this too, but that's not the power of the masses. We really need to kind of spread this news around that far and away above any other health issue, tobacco is the #1 thing taking years off of our lives, far above HIV, far above mental health, far above anything else that we have many measurements for. And so we should know that tobacco is our top killer because it is silencing more people in our civil rights battle. It is silencing more of our friends than anything else. So please talk with your friends and the LGBT people you know around that. And then the third thing I'd say is speak up to the organizations that should include this. If you have contact with an LGBT community organization, please ask them if they're offering anything for tobacco control programming. Do they have good, clear tobacco policies up? Things like that. If not, then the other people you should talk to are the people who do the normal tobacco control programming, our departments of health. And literally, we urge people, just write your Department of Health, and it will be at the capital of whatever state it is, and ask them whether they're including LGBT people in their tobacco control programming, and do they have active programs funding LGBT organizations to make sure we're included in the tobacco control messaging, because thinking that you can treat everybody the same is just going to leave us behind. So I urge you literally to write your Department of Health and ask whether this is happening or not, because if it isn't, they'll listen to it if people speak up and speak out. Those are my three.
I think to add to what Scout is saying, as individuals, I think it's a need to be willing to have uncomfortable conversations, because when you're addressing the issue with friends, with local organizations, you're oftentimes going to meet with some resistance, and there is being willing to step out and be uncomfortable in raising those issues in social settings or with organizations is a significant risk. But in order to make this movement go forward from an individual basis, I think we have to be willing to take that risk.
I think those are excellent ideas, so I'm not going to repeat them. But actually, one thing I would add to them is that there's a disconnect between what is the burden of tobacco in our community, and we know it's high. I mean, unfortunately, we don't have the numbers. Down to the fact that we're not being counted, and if we're not counted in surveys, we do not exist. And one of the places where we first have to start being counted is in the SEER database. The SEER database is run by the National Cancer Institute. It tracks the cancer incidence in the United States. They do not collect data on sexual orientation and gender identity. This is, it's at some level, it is our tax dollars that are funding that particular registry, and the fact that we're not even talking about the state registries, but even at the national level, who the states feed the data to the national registry, that we don't exist. And it doesn't take a scientist to say, gee, we smoke at higher rates, we may have higher levels of cancer due to tobacco-related diseases, but we're not counted. And if you think about it, the estimates of how big the LGBT population is, we have between 3 to 7% of the general population is LGBT identified. So if you do the math, that we're looking at the population the size of the state of Iowa or New Jersey. Can you imagine if the U.S. did not have data, cancer data on the state of New Jersey?
Hmm.
We will be okay with that. And the fact is that the U.S. does not have data on the cancer rates of the LGBT community, a community who has higher risk for cancer due to higher levels of tobacco use. So I would say one thing is work with your voluntary organizations, American Lung, American Cancer, American Heart, you know, send letters to your congressman to really have us be included in the National Cancer Registry. Because until we get the reality of the burden that tobacco has in our community in terms of death and mortality, all of us are going to keep on piecemealing data together to make the argument. But we should be counted. We should realize how much the death that this is causing in our community day in and day out. So that's one thing. I think that the other thing is, that we've survived quite a bit as a community, and we continue to survive quite a bit. And that tobacco is the most preventable. I mean, tobacco-related diseases are literally preventable in terms of public health. That this could be prevented, and I think as a community, we need to rally up and kind of say, we can prevent this in our community. We've survived quite a few other things, so we made some successes, and I think we can do the same thing around tobacco.
I know we're short on time, and I think that's great to end on an upbeat note that Francisco just brought us, that there have been so many great changes over the years, hopefully us as individuals, our families, our communities, and look at so many things that we have to celebrate. We just have to be aware, educate ourselves, and look to our side, make sure that we achieve true health equity. And the definition I like the best is thinking, is it fair? And is it just the work that we're doing?
Well, on that note, I do want to say thank you again so much to our 4 panelists, Dr. Scout, Linda, Francisco, and Bob. Thank you so much again. This has been great, and this conversation, all of the rich content will be saved and uploaded, and we'll make sure to distribute the link so that these conversations can continue to be had. And I will post the link that Dr. Scout mentioned, the Huffington Post link, among others, on our event page so that these resources we've talked about are easily accessible. So thank you again, and if you're interested in using our film, Addiction Incorporated, to help advance your tobacco education efforts, please feel free to contact the Adrian Jules Foundation at info@adrianjulesfoundation.org. Thank you so much again, and have a great rest of your day.
Thank you a lot. Thank you to the foundation.
Bye.